Excellent. Thank you, Dr. Ramji. And if we could go to a split screen, if possible. We have prepared this as a conversation with myself and Carrie, or perhaps we can go to Carrie. Seems that we're in a little bit of odds technologically here as well. Carrie, are you with us? There we go. I see you now. Hi, Carrie.
Hi.
Hey, good to see you. Thank you for joining us tonight. And this is a tremendous opportunity and a tremendous honor to be able to speak with everyone. I was going to give a quick introduction for each of us, but Dr. Ramji has given a great synopsis of where we're coming from. I'm with the Global Liver Institute. Carrie, you're a patient. This is a great opportunity for us to learn a little bit more from the patient's perspective. And so I'm going to spend the next 15 minutes or so. Carrie, you and I had a great kind of pre-meeting conversation about things. We actually went way longer than 15 minutes. So let's see what we can accomplish here in this amount of time. Tell folks a little bit about how you got to this moment, about how you got here. As a liver patient, talk a little bit about your initial journey and especially your contacts and interactions with primary care.
Sure. So back in January of 2021, I realized that I had had swollen ankles. I realized that it had been probably about a month and it really wasn't going away. And the only thing that I could really kind of guess was that it was maybe caused by, I'd had a flu shot a few months prior and it kind of gradually progressed. So in January, I decided to make an appointment with my primary care provider, and luckily she was really good at liver disease and recognizing the signs of that. She saw that when I first received my diagnosis, my initial alkaline phosphatase was 486, which is like much higher than what the norm should be. It should be 117 or less. And then my other liver enzymes were 111 and 114, and those should be respectively 64 and 37. So I was something like 3 times higher than what I should have been. So when she got those test results, she immediately called me and she said, "You need to drop what you're doing and go to the emergency room," which was jarring for me, especially because it was during the height of COVID. I had never been hospitalized for anything, and I had never really been to the emergency room by myself before. I had been with my parents, I had been on behalf of other people, but never on my own. And I had to go by myself. And that emergency room visit led to seeing my gastroenterologist and then a hepatologist. And that eventually led to my hepatologist now, which happens to be through the University of Chicago with Dr. Mary Ranella.
Yeah, excellent. So I'm really curious about this pathway, this journey that you've been on with this, and how it may be able to better inform. So, you as we had our conversation, one of the things that you noted was that aside of swollen ankles, you are not symptomatic. Correct? Can you
Correct.
talk a little bit more about that?
I felt fine. I didn't have any nausea. I didn't have any things that you typically associate with feeling sick. Um, at least I wouldn't say that back then. Now I realize after I've improved a lot that I probably did have some of the things. I just wasn't noticing them because they had been part of like regular life,
Mhm.
such as fatigue and tiredness. I should note that at my time of diagnosis, I weighed 314 pounds, and now I weigh 198. So I have been able to work on that weight loss and maintain that for 2 years. And I really did. I felt well when I was in the hospital, which really ended up being to my benefit because patients who don't feel well when you're in the emergency room and you're by yourself, you're really at a disadvantage for being able to advocate for yourself. And that is a necessary part, especially in the United States, unfortunately, where the healthcare system is pretty taxed. And a lot of times we're dealing with staffing issues. So patients really need to be able to advocate for themselves and ask questions about what's going on. And I was able, for the most part, to do that. So that really helped me out a lot.
Foremost, congratulations. I mean, I think we in these conferences so often get caught with trying to diagnose. We're going to have a case study coming up after this, trying to figure things out. And this is really nice to have a success story. Granted, it is still evolving, and I think that's one of the lessons to pull from this is that it does take management in this way. When you talk about the weight loss, we just came out of a conversation where they were talking, pretty scientific stuff, GLP inhibitors, and these things like this. What do you think do you think that the weight loss was a key for your recovery? And if so, what were the main things about that weight loss what did you do? I mean, how were you successful?
It was definitely a key for my recovery. One of the other doctors mentioned that the typical advice is lose 10% of your body weight and we'll see you in a year. And that for me was something I didn't receive that exact advice, but I did receive the 10%, lose the 10% of your body weight advice and follow the Mediterranean diet. By the way, there's a modified version for liver disease. And here's what you should be eating. And that was it. That was kind of what I was sent away with for that particular visit. Luckily, my hepatologist, even my first hepatologist, was fairly versed in that. But I think following that diet and learning what that is, having a dietitian specifically was what helped me the most. Aside from having access to really great healthcare and then eventually landing in the right place with my disease, which happens to have an autoimmune component, we feel, which is how I landed with Dr. Ranella, because along with Masled MASH, her other specialty does include autoimmune liver disease.
Awesome. You and I spoke previously about the nutrition aspect of this. And I think one of the things that we have found from Global Liver Institute's perspective, when we speak with patients globally, is often their experience parallels yours, especially early on in the engagement, which is they see primary care or early on in the specialist, and the prescription, if you will, is just lose weight. And then it's prescribed as 10%, and then they're told to eat a Mediterranean diet. When you and I spoke about this, we started to kind of run the traps on that a little bit, especially around the Mediterranean diet, I think, as more representative of a good diet as opposed to actually eating a Mediterranean diet. You even mentioned a liver health kind of version specifically. I'm wondering if you can talk a little bit about the components of nutrition that you found helpful going forward. So our primary care and our providers in the room can learn a little bit about what was actually helpful for a patient as opposed to just lose weight and eat grape leaves and drink wine.
Yeah, exactly. And drink wine is not one of the recommended. In fact, as Dr. Ranella said, eliminating alcohol as much as possible is the best course of action. But as far as like the Mediterranean diet, I personally had to adjust to that. I was one of those people who really liked a lot of carbohydrates, donuts, cookies, you name it, sweet things. And those are actually designed by nature to get people addicted to those so that they, in my opinion, so that they buy more of them. But I think what you'll find is if you follow a healthier diet, eat things like salads, things like vegetables, whether it's peppers or tomatoes or whatever it is that you prefer that's a vegetable, find something. I started out with like 3 different things. I liked green beans and broccoli and maybe sometimes a potato, which isn't actually part of the Mediterranean diet, but it's certainly better than the refined carbs. And
excellent. So go ahead. Sorry, I didn't mean to interrupt.
Just to allude to that, the potato thing, finding a healthier version of what you already like is often, for me, the best way to kind of up that ante a little bit. Because if you like it, you're going to want to eat it. Yeah. And then that eventually leads to, I really don't want the processed foods anymore. The things that I thought tasted really good actually taste like chemicals now.
I think we find that universally. Once you step away from something that previously you may have liked, like a sweet of some sort, and then suddenly it can be overpowering. So we just have a few minutes left here, and I want to get your perspective on one last thing here, if we may. You have obviously had an amazing journey so far. The journey continues for as it does with all liver patients. You're in great hands with Dr. Ranella, and so there's a hope for a lot of optimism in this. In looking back at your experience, what is the advice that you would give to both primary care providers or providers early on in the process and to patients that may be engaging primary care or a specialist early on in their diagnosis?
Be proactive. That's the key. You can always, when you receive this diagnosis, the first advice that I received, because my initial thought with my gastroenterologist is, I don't want to make these changes. And then she said, that's great. You don't have to make these changes. You can choose to do nothing. That's always part of your choice, but you might never improve. And that really struck a chord with me, that I wanted to improve, and I wanted to improve really drastically as much as I could. I do have Masled MASH. I also have components of autoimmune hepatitis, PBC, and I have cirrhosis. So the cirrhosis, unfortunately, I'm kind of stuck with that. But the rest of this can be improved through medication, through lifestyle habits, through dietary changes. So, but even with all of that, if you're not proactive, it won't change. So you've got to want it. You've got to be proactive. And I am more than willing to be the voice that says to someone, yes, you absolutely can do this. It's going to take time. It's going to take patience. It's going to take going through and deciding what you like and working within your parameters. Because there have been some mentions tonight of people who have physical disabilities, people who have very limited profile of what they'll eat, people who don't want to do this. And to be that inspiration to, and that's not really the word that I'm looking for, but to be someone who says, yes, I can, and yes, you can. Here's an example. I want to be that example for patients, and I want them to want to be healthy too, so that, because otherwise, why do all the other things if you don't want to be healthy? Why fight with the medications? Why push forward in so many other ways? It's what makes it worth it is that you get a life to live at the end of this, or through the journey of this, that you get to enjoy other parts of your journey. That's really the quality of life that you're going for.
Excellent. Well, thank you, Carrie. Again, congratulations on where you are in your journey. Best of luck continuing that. We look forward to you joining the community of patients that you're already a part of, and nothing is as powerful as the patient's voice. And so thank you. And thank you to Michael and your organization and everyone that's stayed online with us here on a Thursday evening. We'll look forward to next year and next year's conversation as well. Thank you, Carrie.
Thank you. Thank you for having me. And thank you for Fatty Liver Alliance and Can Nash for inviting me here tonight.